some of the static or background noise on the line. And if you don't have a mute button, you should be able to mute or unmute your phone by pressing *6. That's all I have. Sorry.
All right, very good. Thank you so much. That should be helpful to us. Well, if we can go to the next slide. I just wanted to outline for you what it is we'll be doing this afternoon. I'm planning to talk a little bit with the slides and just to review briefly what we mean or are thinking about when we use the term academic health departments, and then to introduce you, if you're not already aware of it, to the academic health department learning community. But then I plan to stop talking and give all of you an option to engage in a conversation with each other and with me, where we can talk about any particular needs you may have or opportunities you may be aware of that might be appropriate for the group to hear about, and for us to do our best to answer any questions you might have. So I'm hoping we can have as in-depth a discussion as you would like at that point. If we go on to the next slide, just in terms of background, the academic health department learning community is a program, I guess, or at least a function of the Council on Linkages between Academia and Public Health Practice. This is a group that's been together for roughly 20 years now, established in direct response to the findings of the 1988 Institute of Medicine report on the future of public health that complained about the lack of linkages between public health academia and practice. And so what we've been doing during the past several decades is what we can to try to foster those relationships. The council is made up of representatives from the 19 national public health organizations that are listed there on the right. And as you can see on the left, our mission is to improve public health practice, education, and research by doing the three things that are there in the bullet points that I don't think I'll bother reading to you. You should know that our efforts have been funded by the Centers for Disease Control and Prevention and the Human Resources and Services Administration. And it is staffed, we are staffed by the Public Health Foundation. Go on to the next slide, please. So, what is this academic health department stuff? You know, the council has been interested for many years in this idea, and we've been doing our best to begin to develop a sense of just what it is. And while it's sometimes a little bit difficult to define, we decided to move ahead with a really very general description. Initial. Sorry, it's got some real interference on the line at this point. Okay. So, as you can see, we just saying that it's an affiliation of a health department and an academic health professions institution. That's about as broad and general as you can get. It's done so on purpose because there are so many different kinds of relationships. It sometimes helps our clinical colleagues to understand this by describing it as the public health version of the teaching hospital and medical school partnership that many of them are more used to seeing. So when the teaching hospital is the site for teaching clinical practice, the public health department and, of course, other community agencies can very well be sites for students to learn the practice of public health. At the very least, it is a collaborative relationship that's focused on enhancing public health education and training, research, and services. And, of course, when it exists, it really strengthens the linkages between academia and public health practice, something that we think is going to be increasingly important as health reform proceeds. Go to the next slide, please. Now, as we've looked at some examples of academic health departments, we have identified a number of things that we call elements that are likely to be present I should remind you that this is not an exhaustive list, nor is it a list of things that must be present for an institution to think of itself as an academic health department. These are the kinds of things that may exist. Sometimes all of them do in a particular setting, sometimes just a few. Of course, the first one is universal, and that's there is some sort of a relationship between an academic setting and a public health practice organization. Now, it's not unusual as these relationships proceed over time for them to eventually end up with a formal written partnership agreement, trying to institutionalize the arrangement that often starts between several individuals who are like-minded in several different kinds of settings. Clearly, it is a collaborative effort to promote public health education or training. That often is the initial part of what happens here as these come together. We sometimes see joint research projects, that is, research projects that involve both the practice setting and the academic setting. Sometimes public health services are shared. One helps the other provide those services. Sometimes personnel are shared, even to the degree that salaries are paid part by both, or by a number of participating institutions. Usually there's some sort of sharing of resources, and occasionally you'll find compensation for services provided, particularly compensation from the local health department for services provided by health professionals. There are other things, as I said, that are likely to be there, but those are some of the ones that seem to be the most common. So if we go to the next slide, please. So many folks ask us, how might an academic health department get started? Quite frequently, what we've found is that students, that is the academic setting, realizes it has a need to provide sites for practice experiences for students. So the practice agency is contacted to provide student internships or practical experiences of some other kind. Occasionally, then, the academic setting will call on community health practitioners, public health practitioners to come in and teach, provide guest lectures, or to provide some sort of avenue towards the real-world approach to problem solving, go along with the theory that's presented in the classrooms. As a corollary to that, it's not unusual to find an academic institution, for example, that has a particular research interest, and they need the kind of introductions to community agencies or access to community data that's available through a local health department. So they will move to provide to develop, really, or gain access to community populations and health data. Sometimes in doing that kind of research, all they really need is a letter of support from a practice agency in order to satisfy a funder. But then sometimes the health department itself will participate in a practice-based research network that will link them back to an academic center. And then the kinds of services that can be provided. It's very nice as a practitioner sometimes to have, at least in my case, I was always glad to have access to a friendly epidemiologist who could help me interpret the latest finding that's ballyhooed in the media, so that I could be sure that when I was asked what it meant, I would have a reasonable response. And sometimes then, the local health department will begin this by, say, hiring residents or providing practice sites for residents to deliver health services to health department patients. And then, on the next slide, these beginning efforts tend then to, in most cases, move ahead to more complex arrangements. So that you may find academic centers who then get involved in helping to keep the public health workforce up to date in terms of education, so begin to assist the department in its continuing education efforts, and may indeed proceed to actually providing faculty appointments for health department staff that are providing services to the educational institution, principally teaching, but it may be other services as well. The joint research projects then sometimes tend to advance to the point where it really is more of a collaborative effort rather than the academic center looking for some sort of connection that will give it access to data. The involvement goes more both ways, and so the local health department folks often then find themselves approaching the academics to help them design research approaches that will answer the kinds of questions or solve the kinds of problems that they're facing in their practice settings. And then the data collection tends to be shared more appropriately, and both the practitioners and the academicians are involved in the reporting, the writing, etc., that may go on after an analysis is done. And then, of course, the public health services themselves or the clinical services often then morph into a combination, particularly these days, with the requirement that so-called not-for-profit hospitals do community assessments, and local health departments seeking accreditation also have to do community assessments. There is, I think, a strong effort where those two conditions exist in parallel to bring them together and to see if those two groups couldn't combine their efforts to produce a single community health assessment that meets the needs of both settings. Next slide, please. We're often asked what sorts of things help an academic health department develop. And of course, these are all environmentally specific. It really depends on what things are like in your own setting. But some of the things that people report to us that really help are having a sense of open communication. That is the sense that you can speak freely back and forth about the needs of your own particular setting and what you might be able to provide to help meet the needs of the other. Having an understanding and respect for the different organizational cultures that are involved. Culture is a word that gets used occasionally to suggest that the academic culture and the practice culture are really quite distinct. They have different drivers, different expectations, different reporting mechanisms, etc. And it can sometimes be hard to mix the two unless each has some understanding of the particular needs of the other and is willing to compromise or work with the other to try to help them meet their own particular expectations. Often these things begin, almost always I would guess, with somewhat informal relationships where professionals on each side of this equation learn about the other and begin to approach them to see if there might be ways they could work together to solve problems, meet needs, and they sometimes then move ahead from that into something more formal. But there's no reason to be very formal at the beginning. Just having initial conversations that are open and direct with an understanding of each other's needs can lead really to the first steps developing quite easily. It appears if you're going to start this and keep it going, it really helps to have a champion in each organization that's involved, someone on the inside, preferably with some administrative clout, who really feels strongly about this and is willing to find ways within the culture of the particular organization they represent to make the partnership work. You all know that if you don't want something to work, it's easy to find reasons why it won't. If you do want something to work, then there's more of an effort generally focused on trying to find solutions to administrative roadblocks along the way and to figure ways to help pull the whole thing together. Certainly, if you're not in the if you're the champion but not in in a real leadership position, then you really need to have leadership and staff support for what you want to do. If you're the only one interested in this, in many cases it can be a very lonely effort. So the idea of mutual buy-in is important. Time and patience. Perhaps patience first, with the understanding that it may take some time for these relationships to develop, evolve, and gel. Of course, it's hard to be a public health worker and not have patience, I guess. But the patience can really be important at times. And then sharing responsibilities and benefits as well as risks. Now, really, in many ways, that's all a way to say, look for overlapping agendas. And if you can find those overlapping agendae, then chances are good that you'll be able to find some way to develop a linkage that's worthwhile. Now, I'll get into later some of the resources available through the Public Health Foundation website, but we do have a number of documents there that I think will help support what we're saying here and explain it a little bit better. And so if we go to the next slide, the question is, why do all of this? Well, among the benefits is this list. This is, again, is not an exclusive list, even a complete one, but it is, I think, representative of the sorts of things we see. Most people who get into these relationships believe that they've been able to identify community health needs more effectively. It is a way to help build the evidence for practice-based interventions and to move the evidence into practice. It does help maximize the use of resources. Certainly, most of these entities are public funded, both on the academic and the practice side, and the sense is that if you can bring these two entities together, the bang for the buck increases, and the public gets a little bit more for the money it invests. Certainly, giving students access to practice experiences does better prepare them for public health practice careers. And from the practice organization's perspective, having access to students gives you a real advantage when it comes to recruitment, because you're able to see how the students work and to find the ones that you'd really like to have as employees in the future. For the public health practice staff, having students around certainly facilitates lifelong learning. Students tend to ask questions. Most practitioners would rather not be embarrassed by not having any idea what the student is talking about, and so most of the ones we speak with tell us it's a real incentive for them to keep up with the literature and to try to stay at least a few steps ahead of the students they're interacting with. And of course, it comes back the other way in terms of the academicians. Once they're exposed to practice, then they begin to get a sense of a different perspective and how it applies to their teaching of theory. Certainly, it increases the awareness of public health among the health professions as students spend more time in public health practice settings. And with the now accreditation process for local health departments, this does help meet accreditation standards, which is at least mentioned in one or two of the domains in those accreditation standards. But the real bottom line is most people who do this believe that it really does help to improve the public health system and the community's health. So if we go to the next slide, please, let me move from sort of what the basics of an academic health department are, why you should have it, and what impact it has to the academic health department learning community. As I mentioned, the Council has been concerned and interested in this concept for a long time. And we've, particularly as health reform appeared and began to impact all of us, we realized that there really wasn't a central focus on the potential that existed for local health departments to interact with academic centers. And it seemed that given the resource-poor environment in general that public health faces, and the growing agenda at the same time, that it is unlikely that public health practitioners would have the resources required to actually do what we know can impact community health unless they develop a whole variety of partnerships. And certainly partnering with academic health centers or just academic institutions in general could be a large part of that growing need for partnerships. So we thought this would be an important time to begin to try to better understand the concept of an academic health department, and quite frankly, to involve people who are interested in this issue in a community that would begin to explore what it really means, to help determine what the value might be, and if value was understood, to help promote the idea and assist those who would like to either start or evolve the relationships that they already have. So it was a little over 2 years ago we decided to try to develop a learning community on a shoestring budget, of course. What else would it be in public health but that? And we've been gratified actually by the response to the concept. We now do have a national community of professionals that are focused on developing, maintaining, and expanding academic health departments. I think we're a little over 260 members right now, and it includes practitioners, educators, and researchers, almost all of them working in public health. We are, as I said, trying to work together to explore the academic health department concept and do so in a way that encourages sharing, learning, and collaboration among all of us. Next slide, please. Now, the way this learning community works so far is that we meet generally about 3 times a year at this point. Our meetings are at least in the past, have been conference calls and webinars like this one. We've had, for the past 2 years now, an in-person meeting each year as well, and that in-person meeting occurs at the American Public Health Association annual meeting. We expect to have something similar going on this year, so those of you who get to APHA, please look in the agenda to find us and come spend some time with us. So we, again, have been interacting in those ways. And additionally, we have a Pulse blog at the Public Health Foundation website. And listed on the slide are some of the issues that have been discussed in that Pulse blog. We'll be capturing information from these webinars and do another post after next week's second webinar. And we'll be sending that out to our learning community in the near future. This is an opportunity, a place, by the way, for any of you to tune into the conversation and add your voice to it. So we would welcome your participation there. But as you can see, the kinds of things we're talking about is the learning community itself, how an academic health department develops, how you translate research into practice, academic health departments in this evolving environment, as there are some new challenges and opportunities for us here, and so on. So we'd encourage you to visit the website. We go to the next page. On the website, some of the things you'll find include what's on the slide here. We do have a concept paper that describes the basic elements of the academic health department model. We call it a working draft because we think it's an open, living document. Some folks have told us that it has been helpful to them to sort of download it, print it out, and share it with people they are discussing this idea with, because it does, in just a couple of pages, put into words, I think, some of the things we've been talking about. So it's a fairly concise description of what's going on. There is also a bibliography, which is unfortunately still a small bibliography. There hasn't been a whole lot written about this, but we're trying to collect articles that refer to academic health departments. So you'll find a list of academic health department related literature, which we continue to update as new materials are discovered, just as we are willing to rework the concept paper as people read it and make suggestions to us about how it could be improved. So you're certainly welcome to do that as well. And because many of these relationships proceed to formal partnership agreements that are, of course, highly specific to the environment in which they develop, nonetheless, many folks are wondering what sorts of things should be in a partnership agreement. So we've collected some that we can, and where we have permission, we've put some of them on the website. So you're certainly free to go there and get a sense, at least, of what some folks have thought was important to include in those agreements. If nothing else, it may provide some food for thought, perhaps a little guidance at how you might approach this in your own particular workplace. And if any of you have formal agreements that you're willing to share, we'd love to have you share them with us. Get them to Kathleen, and we'll share her email address with you soon, and we'll help make them available to others who may be interested in them. We have other resources. We have a discussion paper that highlights the potential benefits of academic health departments that's designed to facilitate discussion about them. You might find that of interest as well, depending on where you are in your own thinking about this. Well, all of these resources are developed with input from the learning community, and they're all available through the Public Health Foundation's Resources and Tools Library. The next slide, please. Another thing you'll find on the website are personal profiles for academic health department learning community members to share their experiences. Now, we haven't yet convinced all our members to put a profile up. We'd love for more folks to do that. I don't know, Samantha, is it possible for you maybe to pick out mine as an example? If she can do that, we'll look and see if she can pull it up from the website for you to see. Yeah.
Are we still? Do you hear us, Bill?
I'm sorry?
You can hear us.
Yes.
Okay.
So.
We thought Ron hung up on you for a second. Samantha is going there now.
Yes. It's there. I just want to give folks an idea here. What we're doing is these are not CVs. Rather, we're asking people who are members of the learning community and willing to do this to put a little bit of a profile on our website that describes their background and experience with the academic health department idea, either from the practice side, the academic side, or for some from both. And the whole idea here is to provide people an opportunity to search for folks who may have experience that's relevant to questions they may have. So if you want to visit the website and interact with someone about a particular issue you're facing, we're hoping that these profiles will provide some guidance, because everyone who puts a profile up here, actually all our learning community members, we ask them to be willing to share with others or to interact with others who may have questions. So that's really the intent, and it will give you some sense of just what sort of experiences might be available that you could benefit from. Okay, thank you for that. If we can go back to the slides, just tell you. Yeah, go to the next slide. There we go. So what's next for this learning community, this fledgling learning community, just a little over 2 years old? Well, as I've been strongly hinting, we want to improve the profiles. We don't have enough yet. We want to have more, and we want the website to be a good resource for others, so that these experiences that have already been had out there by others can be shared. We also are interested in doing a needs assessment. That's coming soon. As you might imagine, as the size of the learning community has grown from a few dozen to start with now to 260 plus, it's a large and diverse group, and it's not easy to necessarily meet everyone's needs with at most quarterly conference calls or even the occasional in-person meeting. So we are planning to assess our members to get a better sense from them of what it is we might be able to do that would be helpful. After all, we have some people in the learning community who are very new at this, which I suspect applies to some of you folks on the call. We have others who've been involved in these relationships for decades, where they're really quite sophisticated. There's one health department we know of that has something like 5 or 6 residency programs housed within it, etc. Now, some are quite complex. So we want to be able to find a way to meet the needs that are quite variable among our membership. And as we do this, one thing we're thinking about is topic-specific subgroups. Those are our thoughts, and we'll see how the needs assessment relates to that. But at least in anticipation of what we think we'll hear, we've been trying to think to ourselves about how we might identify particular subgroups that would be better off sharing among themselves as well as with the general membership. So a group for novices, perhaps, about how to develop an academic health department, and then perhaps a more specific one in this current environment could really be opportunities for academic health departments and health reform. After all, the opportunities to collaborate with academic health centers really are quite specific in this new environment. But we don't know much about how this is going. We don't have many good examples yet, etc. This is a potentially very exciting area for us to explore. And there may very well be other kinds of particular issues or subgroups that will come to the fore in all of this. So we invite you to participate with us. Those of you who haven't joined yet, we'd like it if you would consider joining. Another thing we're thinking about is a mentorship program. In a limited way, some of us might be able to make ourselves available to visit sites that are considering entering this whole concept to help people review where they're doing. We could either do this long range or perhaps even on site itself. So that's another possibility for the future. Okay, the next slide. So, first, we'd love to have feedback on any of the things we just talked about, or any other ideas you may have for that matter. But some of the things for us to think about, online now in the group that we have, just to begin a conversation, some topics to think about. What have been your experiences building partnerships, successes, challenges? What would you like to get out of participating in the learning community? How can we be most helpful to you? And would setting up a subgroup, do you think setting up subgroups makes sense? Does this mentorship program make sense? Are there other activities that make sense? Okay. So let's go to the next slide for just a moment. Certainly if you're not yet a learning community member and you're at all interested in this, please join us. There is the email address for Kathleen that I promised you, kamos@phf.org. It's an easy one to remember. If you join us, you will get regular emails from the learning community, another way that we try to keep in touch with folks. You have the option of signing up for the Council on Linkages update. That's a sort of regularly irregular report out to everyone else, particularly after a Council on Linkages meeting, that summarizes what's going on with the Council at the moment. It's involved in many things beyond the academic health department learning community, but certainly that is one of the subjects that would be part of the update, as well as the other activities that are going on. And there is the website address to visit us online. We invite you to do that. So we're intending now to have at least monthly communications with the learning community. We don't fill your inbox up with junk, but if you're interested in this, we want to be able to communicate with you regularly. And we're looking at setting up a listserv that would allow members to message the group directly. So those are options available to you at the moment. So with that, maybe if we go back to the previous slide, I'll stop talking. And we've got about 40 minutes or so to engage in a conversation. So let me stop and offer anyone who would like to make a comment, pose a question, carry us on. I guess I should say that for those of you who are not in a position to be able to speak with us directly, you do have the chat option, so you can type in a question. Staff will keep us up to date on what's going on there.
Greetings. Greetings. This is Claude Jacob from Cambridge, Mass. Bill, thank you for the wonderful presentation, very comprehensive. Seen snippets of it before, so I appreciate just the prompts and the reminders. To that end, I'm impressed by the 20-year history, excuse me, and I'm also thinking about the tie-ins to the Institute of Medicine's report back in '88, just talking about the future of public health and public health infrastructure and the importance of having these networks in place. That said, I was just going to tee up a couple of questions, and I was going to ask my colleague Brenda. Congratulations, Brenda, on the second hat that you are now wearing, and looking forward to hearing about your transition to it sounds like Gonzaga. But what I did want to touch on is the couple different networks that are having these conversations. So NACHO, clearly we have one of our work groups focuses on workforce development, so we're very interested at the National Association of County and City Health Officials on how we can enhance the linkages with PHF and the Council on Linkages. But I did want Brenda to just use as an example one internal conversation that we're having within our section at the APHA that speaks to having more support and tying in with these academic health departments. So if Brenda wouldn't mind, because I know that this is something that we're just now teeing up as a section. Brenda?
Mm-hmm.
Oh, unless she's in listen-only mode now.
Well,
let me just
a reminder not to use the phone, but Claude, maybe you could describe it if Brenda can't get onto it.
Sure. We as an outcome of internal conversations with the chair of our section, there's a newer work group that's been created looking at the academic health departments, and it started out as a question about how we could be a better resource to students, and we have since pivoted, and we just had a call this week where we're just describing what roles the membership could play within our health administration section in not only embracing students, but even in positioning ourselves as mentors and in being formal members of something like the Council on Linkages. So if nothing else, we're recognizing the product. We're looking at the potential to enhance the network and the support within our section at APHA. And given that this network has been here for some time, it's great to now connect it to the work that we're doing within our respective departments and municipalities. So we're just connecting. It's a resource that we can bring to not only our organizations, but also to serve the students who are active members of our section at the APHA.
Mm-hmm. Well, that's really very exciting, Claude. And I'm glad you're doing that, and I'm hoping some other professional organizations will do it as well. I think particularly APHA, which represents both practice and academia fairly well, is in a particularly unique situation to bring the two together. And we'd be delighted if NACHO and ASTO and other groups would also focus a little bit more attention on this whole idea. So we'll do what we can to encourage them.
That's great. This is Claude again. I just one last question to the. You mentioned that there are over 250 organizations or members that are a part of the Council on Linkages, and I was wondering if that information could be made available regionally. When I think of the way that we're configured in the Northeast, small geography, and I'm just thinking about the opportunity to just identify whether it's the academic institutions or even the nonprofits or any of the other organizations that may be considering this or are members of the Council on Linkages.
Before I ask Kathleen a specific question about that, just point out the members of the learning community are individuals, not organizations. We have several individuals, I think, from some organizations but they represent themselves first. The Council on Linkages, of course, membership is organizations, and the organizations pick their representative. Kathleen, what's the deal with sharing the list of our members beyond those that have done profiles?
We certainly have a list. We haven't yet made it public. I know that some people, when they signed up, had requested their information not to be put on our website, so it's something we had sort of hesitated a little bit till we actually got to talk to the full community and see what they thought. But I think what Claude is suggesting is very useful and something we've been having a lot of internal discussions about here. How do we show where people are located? If there are 10 people who are working on this in the same community, wouldn't it be great if they could know who else was involved? And so I think it's a great idea. I think it's something that we can potentially explore a little bit more as we go forward here.
Actually, maybe it should be an agenda item for our next meeting of the learning community.
Yeah, we could do that.
And Bill, this is Ron. A shorter-term solution is that if somebody wants that information, if they simply email Kathleen, and if they ask, are there others within my general area, we can provide that information back.
Yeah, definitely. I'm happy to try. I know we've done that a bit so far, like not on a full-scale level, but when people have questions, to try to help make connections between people in the learning community, or from someone who is maybe outside the community but looking to learn more about academic health departments or the types of relationships that exist, to try to hook them up with people who have some of that experience. Yeah, we're happy to do that.
All right.
Hello, this is this is Brenda. Yes, I sort of lost the call for a moment. I was watching the PowerPoint. First, thank you, Claude. But this has been so useful to us, Bill, because those of us who are part of the APHA affiliate really want very much to help in a way that is beneficial to all of the constituents in the academic health department. And we had thought perhaps a questionnaire would do that, but after watching your PowerPoint and listening to you, I'm wondering if maybe helping with the profile expansion component, maybe we could help you to build your profile component, or however we can help. That is really what we feel is important in terms of APHA making a contribution. Don't you think so, Claude? Claude there?
Hey, Brenda. This is Claude. Yes, I like that suggestion. And just thinking about where we could assist by just amplifying the visibility of the members that have profiles. So that is spot on. And also thinking about Ron's comment, I think that's the best way to approach it is on a voluntary basis. If folks have an interest regionally, then they could just query the PHF staff, and then you could make that information available. The backdrop behind my suggestion is that in the Commonwealth of Massachusetts these days, which could be the trend in a number of states, there's increasing pressure to share across jurisdictions, to share resources. And so it dawned on me that as an inventory part of the exercise, it would just be good to know if there are others thinking the same thing, so that if an opportunity to establish some linkage strategically, that we could do so around the concept of the academic health department. So yes, Brenda, I think there's an action item for our section, and I do agree with Ron's suggestion about how we could get this information out regionally.
Right. I think so too. So we're here to help you, Bill and Kathleen.
That's terrific. That's terrific. We really appreciate that. Thank you so much.
Certainly.
Are there other questions or comments?
Yes, this is Julie. I have a suggestion on the topic we're talking about. Would it be possible to create a map, in addition to the profiles, that would show the whole United States, and on a voluntary basis, anyone that has formalized the academic health department could basically get a pinpoint on the map, and that would indicate that they're willing to be contacted, obviously. But so it would be a different sort of a resource. Right now we've talked about how to find people who are interested in forming one or maybe started forming one, but this would be for those who've already formed it. And then the type of information that I would find useful would be obviously seeing the location, the number of years, the year that it was formalized, perhaps the name of the partnering organizations, and then a website if it's available, contact person. I just thought that would be a visual way that anyone who is in the process of forming one could, rather than sorting through names on a profile and clicking on each one, could just look at a map of the formalized ones. Just a suggestion.
It's a very interesting one. Kathleen, what do you think?
I love it, Julie. That's something actually we've played around with a bit here too, in terms of one of my big desires was to be able to see where people were located. So we haven't taken it as far as just, saying which health departments have formal partnerships, although that's certainly a good idea. But we had internally been playing around with maps and how could we visually represent this to people rather than having to, read through a long list. Could you really easily see who was where? So I think it's a fantastic idea.
Oh, I do too. In fact, I was using that concept of looking for a house in Spokane. I was clicking on a map and coming up with all sorts of information. I thought, this is a great visual. I think that's a fantastic idea. Do you think it's possible to get a small grant, to build a map like that? I'm wondering.
but there's a consultation going on back there in Washington.
Ron's going to speak for us.
Well, that's true, but maybe we could reach out to another group. Because I think any information that we have to construct a profile would ultimately go into the map or components of that, because those are really some of the key questions I think that someone would want answered, and maybe we can find a non-Washingtonian group or something.
I think, this is Kathleen again, I think that makes a really good segue to one of the questions that we have in our chat box. Thomas asked the question, are there grant dollars for AHDs? So I just wanted to throw that out there.
I wonder if Robert Wood Johnson would have money. You know, they're so interested in public health. You know, they're interested in underserved populations and vulnerable populations, and I you know, they fund projects on literacy and so many different projects. Perhaps they would have funds. I don't know. I'm not even certain who to ask, but that might be a possibility. Maybe the Kaiser Foundation. Maybe they have unsolicited grants where we could inquire. And there must be 3 or 4 others. I'm just sort of thinking out loud here.
Well, this is Bill again. There were some grants available through the Centers for Disease Control and then through the Association of Schools of Public Health a number of years ago, from ASPH's perspective, to develop health department linkages with schools of public health, and I think the CDC approach was more general. I don't think those monies are available anymore. And so I think it would likely be up to locals to find sources that might be helpful if they really needed funding to do some of this. Most places do it without external funding. It just becomes part of the job of people who are involved. But certainly in some places there are local foundations that might be intrigued by such a concept, particularly if you could build it into the greater issue of, say, health system reform, melding medicine and public health more effectively, et cetera, et cetera. So with the right sort of funding environment and the right sort of creativity, you might have a better chance of finding something locally than at the national level right now, although I'm not quite sure where some of the big foundations like RWJ or Kaiser and others would be at the moment.
Right. I don't know either. Perhaps some others on the call could help, but your idea, Bill, of linking this to healthcare reform, the continuum of care, the emphasis on the preventive model, I think those might be the key words or concepts. So something for us to think about.
Well, this is Ron. Another thought, and I'm not sure this is a good one, but I'll throw it out there, is that a lot of the teaching hospitals in particular are having increasing difficulty justifying some of their research activities and even some of their teaching activities as part of their community benefit. However, if the institution is working with a public health academic institution and a health department together, excuse me, that can potentially better demonstrate community benefits as part of the IRS requirement. And so it's not impossible to think about turning to some of the nonprofit hospitals to help support such a venture.
Actually, Ron, thank you. That may be one of the most universally appropriate approaches. It is our job to help them keep that special tax status.
Yes. Oh.
This this
Ron,
is,
how would we do that?
Well, it's the idea of overlapping agendas again. That's an area where hospitals are going to need help because it seems, at least, given the IRS's current problems, you can never be sure, I guess, but it seems that the IRS is quite serious about this, and that hospitals just providing some pablum about what they've done in the community now and then may not be enough to meet the obligation under the Affordable Care Act. And I can tell you that the executive director of the American Hospital Association was at the Keeneland conference and made the point there that the connectedness between hospitals and public health departments was at a new level now, and that a growing number of hospitals realize that they're going to have to find ways to partner if they're going to effectively meet that obligation. So I think Ron's right on. It means essentially going at that overlapping agenda where, you know, the health department wants to have access to the hospital resources, and the hospital needs the health department in order to meet its obligations.
Oh, this. How can the affiliate group help with this? Bill, and Kathleen and Ron. Ron, would you like to join our group, our affiliate group? We're the Health Administration section of APHA. But how can we help? This sounds like a really viable idea. Don't you think so, Claude? Something we could help with?
Yes, I think, again, by virtue of the conversations is a great start, just to given our shared interests. In terms of how we import this within the section, I know that there are a number of us through the section. I can't remember if there are others on this call who may already be members of the Health Administration section, so if nothing else, it's an open invite. The more the merrier to help us give this some more shape.
Right. We could certainly help, because this could be one area where we could make a positive contribution. And Claude and I are the only two on this call who are members of that affiliates committee. I think some of the others are going to be on the other call, the call that's held next week.
Brenda, this is Ron. You know, another thought is if indeed we have the in-person meeting of the Academic Health Department Learning Community, sponsored by the Health Administration section, this is a topic that could be further explored, and you know, that's just another thought.
That really is a great idea.
You know, one other thing I would mention is that National Association of Planning and City Health Officials has convened a couple of meetings to further explore the whole community benefit concept, and those meetings have involved individuals from academia, from hospitals, from health departments, and some national organizations, and we've been involved with that as well. So as those discussions continue, look for opportunities to raise this issue as well.
Oh, that would be great. This is really exciting because it's such a natural link. If it's written in the right way, with the right phrases emphasized, this is a possible venue for grants.
Yes, it is.
This is Claude. Two other comments. I guess, Bill, you were asking about just some thoughts, and I was thinking that the reality for local health departments, like other organizations, we have limited capacity these days given the economic pressures, but this presents an opportunity to establish strategic partnerships. And so the PBRNs, the practice-based research networks, is there a way to speak to the possible interface with the Council on Linkages, just so I understand a little bit more how that could be, how it exists, or it could be a possibility? Because I think that network is funded by, if I recall correctly, is funded by the Robert Wood Johnson Foundation. The other is that in this conversation, it seems that the Council on Linkages can continue to to serve through its members as a catalyst, demonstrating this connection, like NACHO, ASTO, the APHA, PHF, of course. And so, just thinking out loud that it would be great just to know about the practice-based research networks, and if there's another way to demonstrate this connectivity across the network.
Yes, well, of course, the Council on Linkages doesn't have medical practitioner groups on it. So I think at the moment we are probably not particularly well-placed to actually speak for that hospital health department interconnection, except generally. But the Robert Wood Johnson approach, are you familiar with the Keeneland Conference? The Public Health Services, the Public Health Systems and Services Research Network, with predominant Robert Wood Johnson funding, is centered at both University of Kentucky in Lexington and University of Michigan. There's an annual conference in April held in Lexington that is supported by the Robert Wood Johnson Foundation, where public health systems and services research issues are discussed. The meeting has been growing in size each year. The practice-based research networks are a component of that meeting. There is, I think, a growing awareness in this era of health reform and the Affordable Care Act that the things we've been talking about are indeed real. And so there has been a growing effort to try to make this research very practice-oriented and connected increasingly with essentially hospitals and academic health centers. So that is certainly one venue in which to approach this. And I think the other national organizations are probably increasingly going to have to pay attention to this.
Bill, we also have had a few discussions with the Practice-Based Research Network, and they have been sharing information about the learning community with their members, and we're discussing how it is we can potentially tie together some of these efforts.
Good. So the beginnings are there. I think it sort of falls on all of us to go back to our professional organizations, try to make sure these issues are discussed increasingly and with more focus and target towards actual interchanges, exchanges, and an understanding of what we really need to do. It means breaking out of a lot of silos that people are quite comfortable in at the moment. Well, this is not easy work in many places, but it's the sort of thing we need to do, and the opportunities are there, despite all the shortcomings we all know about related to resources and disagreement about what the national approach should be to improving health. There are some opportunities lurking within those clouds.
Bill, we have a few more comments and questions from the chat box. Would you like Kathleen to?
Yes.
Okay.
All right. So we have a question about, do you have any model practices to see successful collaboration? And I'll throw my 2 cents in there first, if you'll let me. And so this is, again, something that I think we've been talking a lot about and are very interested in seeing develop. It's something that's on our to-do list over the coming months. How can we share? We hear anecdotally of a lot of stories of people like Julie shared in Tennessee, of people who've developed academic health departments and how it's going. And so we're going to be looking at, can we take some of that information and develop sort of stories or make that information available to others so that they can benefit from it as well. I don't know if there are any real other places to go for that information specific to partnerships or academic health departments at the moment, but Bill, do you have any other ideas on that?
Yes, I think I do, Kathleen. First, people could go to the bibliography list that we have on the website. Included in that list are some examples. Also, you should all know that the Journal of Public Health Management and Practice is preparing a themed edition on academic health departments that is due to be published maybe 7 or 8 months from now. It'll contain 12 to 14 papers that will focus on academic health departments, and I'm a guest editor, so I've seen these papers in their initial form, and there are some clear examples there of different approaches for both state health departments and local health departments of perspective, and also then from the perspective of the academic health, the academic site. So that's more information will come out. That will probably increase the number of papers about this by about 20 or 25%, just that one issue. One of the difficulties we have, of course, is that practitioners tend to do more than they tend to write about. So it is sometimes difficult to get people to actually try to enter the academic era by describing the things they're doing. So we're trying to encourage more and more people to do that. So there's not a short time answer to the question from Thomas Orr, but it is in the longer run, you should have some good examples coming up soon.
And so this is Kathleen again. I just put the link for the bibliography in the chat window if anyone wants to go right there. And also we'd had a question earlier about instructions for creating a profile. And so I put that link in the chat window as well, so that anyone who's interested in creating a profile can go right to our website to download the form and then just send it to me, and we'll create a page for you.
Mm-hmm. Okay, terrific. There are other people on the call we haven't heard from yet. Does anyone else have a comment, question, suggestion? Okay, I don't hear any. We've still got about 10 minutes or so left on our scheduled call if there is a need to use it. So just encourage you again, if you're thinking or wondering about something, now's the time to bring it up.
Bill, I have one final comment here in the chat box. It's actually from earlier, but I just thought I'd mention it since we had the time. Thomas again mentioned that research is one of the 10 essential services that often local health departments have some trouble or don't necessarily get as involved in. And so this could be a good opportunity.
Mm-hmm. Yes, indeed. All right. Well, if there are no other questions or comments, then I think we'll draw the meeting to a close. Let me thank you again for your participation. I hope this has been somewhat useful. It's certainly been helpful to us. I think we've gotten a number of excellent suggestions for us to ponder, and we will certainly be doing that. We're looking forward again to our second webinar for a different audience next week, and once we, I think, have completed both, we'll summarize what the suggestions and opportunities are, and probably, Kathleen, that's what will go on the Pulse blog, right?
Yeah, I'll be writing up sort of a summary, highlights, suggestions, ideas, and we'd love to keep the conversation going in between meetings. So we'll be putting that up on our blog, on the PHF website, and I'll be sending the link around to everyone, and would encourage you all to, add any additional thoughts that you didn't, share today or think of immediately. We'd love to continue to hear from you.
Indeed. And of course, any of you who are on the call who are not members of the learning community, if we've stimulated you at all to be involved with us, please join. And don't be hesitant about asking to get more information. It all comes electronically, and there's always the delete button if it's a little too much for you to handle. So With that, let me again thank you all for your participation. I thank the staff for making the webinar work. glad to see that it went smoothly, and we'll look forward to hearing from you in the future. So goodbye and have a good afternoon, good weekend.
Thank you.
Thank you very much. This was great.
Bye-bye.